Eating disorders are illnesses where people, male and female, experience severe disturbances in their eating behaviours and related thoughts and emotions. People with eating disorders typically become preoccupied with food and their body weight. Some of the common eating disorders include Anorexia nervosa, which generally develops during adolescence or young adulthood and tends to affect more women than men. People with anorexia generally view themselves as overweight, even if they're dangerously underweight. They tend to constantly monitor their weight, avoid eating certain food types, and severely restrict their calories. Signs associated with anorexia include an inability to concentrate, poor concentration, low mood, low self-esteem, a change in character, sadness, being easily tearful, displaying uncharacteristic outbursts, being antisocial, self-isolating, being preoccupied with food and or having issues with particular foods, being anxious around food, having irrational thoughts, absences from school. Physical indicators of anorexia include noticeable weight loss, skipping meals, avoiding eating in the presence of others, fatigue, fainting, being sad, moody and irritable, poor memory, slurred speech, where the hair thins and becomes brittle, where the skin is dry and bruises easily and can have a yellow tint, swollen joints, brittle nails, lanugo, which is the growth of fine body hair, constipation and bloating, where menstruation is disrupted or stops, a constant feeling of being cold, inability to participate in physical activity, where physical condition is so poor they're unable to attend school. In addition, the body may be further affected, including changes to brain chemistry, low blood pressure, slow heart rate, palpitations and heart failure, anemia, that's the lack of enough healthy red blood cells to carry oxygen throughout the body, kidney stones or kidney failure, weak muscles, joint fractures and osteoporosis, a bone disease that occurs when the body loses too much bone, makes too little bone or both, difficulties getting pregnant, higher risk of miscarriage and postpartum depression, that's depression following giving birth to a baby. Bulimia nervosa, which also generally develops during adolescence or young adulthood and tends to affect more women than men. People with bulimia frequently binge eat usually large amounts of food in a specific time. Each binge continues until the person becomes painfully full. They then attempt to purge to compensate for the calories consumed by excessively exercising, forced vomiting, fasting and or using laxatives, diuretics and enemas. Signs associated with bulimia include poor concentration, low mood, being tearful, mood swings, a change in character, low self-esteem, self-isolation from others, that's withdrawing socially, fatigue caused by poor sleep patterns, outbursts and irrational thought patterns. Physical indicators of bulimia include eating large amounts of food, drinking large amounts of fluids with a meal, visiting the toilet during and or straight after a meal, cavities, gum disease and acid erosion to the teeth, sore throat and mouth, moon face, that's swelling in the cheeks caused by extra fat that builds up on the face, chest pain, muscle cramps, fatigue, pins and needles in the arms or legs, poor hair and skin condition, poor sleep patterns, sores on knuckles, irregular menstruation, and sometimes low in weight. In addition, the body may be further affected, including depression, anxiety and low self-esteem, soreness, irritation and rupture to the throat or esophagus, anemia, that's the lack of enough healthy red blood cells to carry oxygen throughout the body, irregular heartbeat, weakening of the heart muscle or heart failure, low pulse and blood pressure, stomach ulcers, constipation, irregular bowel movements, bloating, diarrhea and abdominal cramping, dehydration. Binge eating disorder is similar to bulimia. However, people with the disorder do not use purging behaviours. Binge eating may affect the body, including profuse sweating in the armpits, stroke from high blood pressure, enlargement of the heart or erratic beat and heart disease, sterility of ovaries and cancer, kidney stones, kidney failure due to high blood pressure, varicose veins, uterus and cervical cancers, gallstones, diabetes and breast cancer. Pica involves eating things that are not considered food, for example, soil, soap, chalk, paper, hair, cloth, wool or stones. People with pica have an increased risk of poisoning, infections and injuries to the gut. Rumination disorder is a condition where a person regurgitates food they have previously chewed and swallowed, re-chews it, then either spits it out or re-swallows it. The disorder can develop in infancy, childhood or adulthood and can result in weight loss and severe malnutrition, which can be fatal. Avoidant restrictive food intake disorder generally develops during infancy or early childhood and can persist into adulthood. It's equally common amongst women and men. Those with the disorder experience disturbed eating due to lack of interest in eating, distaste for certain smells, tastes, textures or temperatures of food. Eating disorders are not about food. It's about controlling food intake as a way of coping with feelings that are making someone unhappy or depressed. As such, food becomes a problem as it's manipulated and used to help cope with painful situations, feelings, or to relieve stress. These disorders have a profound effect on the person and their body and can lead to death, either from the impact of the illness or through suicide. They are complex illnesses to treat, but recovery is possible. The action taken by schools to support pupils with diagnosed eating disorders should be guided by professional advice and support. However, there are some key principles which should be applied. Ensuring all identified staff understand the pathway to be followed to enable delivery of the best possible support. Identification of who is best placed to directly support the pupil. This should be someone who the pupil has a connection with and feels comfortable to talk to. Demonstrating compassion and care. Developing trust. Awareness of the wider issues that may be affecting the pupil due to the impact of their eating disorder, for example, making and maintaining friendships. Ensuring the pupil has privacy when changing for PE or other activities. Making sure water is readily available. Ensuring the pupil has enough time to eat snacks and meals. This may be significantly longer than usual. And, if directed, opportunities to eat away from their peers. It's important to recognise that the pupil may feel uncomfortable at lunchtimes and they're an ordeal they have to get through rather than a pleasurable experience.